Hi, I'm Robert Fick, and today we're going to do a rapid strep test, which is a test for group A streptococcal bacteria.
Strep is just a streptococcal infection that sets in your throat. But strep, can set in pretty much anywhere in your body. Strep is usually pretty easy to recognize in the throat because you get white patches.
Rapid test means you do the test in the office, you get the results in the office. You don't send anything out, so you get the results right there.
A lot of patients who can have a pretty severe sore throat, but still not have strep throat.
And a couple of things that we're going to need is, one, we're going to need a tongue depressor. And we're also going to need a rayon-tipped, cotton tip applicator to collect a sample from the back of the patient's throat. Okay? First thing we're going to do is we're going to look at the patient's throat. Have the patient open up and say, ah. All right. And what that does is gives us an idea of what we're working with, also gives us an idea of where the infection might be. And sometimes you can see there might be a white exudate on the tonsils or on the back of the throat, which would be an indication that the patient does have strep.
With me, I've got 3 kids. If my kid says it's got a sore throat, okay, fine, go gargle with salt water, take some Tylenol and go to bed. But as soon as I start seeing those white pockets, then it's like, okay, we need something bigger than just palliative care here.
All right. Gives us an idea of what we're gonna be seeing and working with back there. We're gonna open up the packet containing the cotton-tipped applicator, and remember this is sterile inside, so we don't want to touch the end of the applicator. Okay?
Talk to the patient, explain to them, I'm going to swab the left and right side of your throat. It may trigger your gag reflex. I'm going to do it very quickly. I want you to open your mouth, say ah, and I know that sounds silly, but when you tell the patient to do that, their tongue actually moves down and it opens the throat. And as soon as they do that, I swab left, right, and come out.
Get as absolutely far back as you can with the swabs, which immediately causes them to gag. So it may take a couple times to swab, but as long as you can get a good swab and you can hit the areas that are really red or white, then you can usually get a pretty good positive test.
Okay, we have the patient open up and say ah. And while she's saying ah, we're going to push down on the tongue, which actually lifts the back of the throat and tonsils and gives you a better view. And then on each side of the throat, we're going to touch and twirl the applicator to get our sample.
You swab the back of the throat, which is actually the tonsils.
I take extra time to tell the students to be sure to explain themselves to the patient. I'm going to be sticking this swab way back in your throat. You're going to be coughing. I want you to try as hard as you can not to cough. And, it's going to take just a second, but I want to get a very good sample so that we, get the best results possible.
If you don't explain to the patient what you're doing, and they're trying to talk while their mouth's open and their tongue's up, you're not going to get a good swab, and probably, a false negative if they do in fact have it.
Okay, we're ready to test the sample that we got from our patient. And the first thing we're going to do is we're going to follow along with the procedure card that comes with every test kit, and it's going to tell us in step-by-step instructions how to complete the test. First thing we're going to do is we're going to add 4 drops of our first reagent. All right, our second step is we're going to add 4 drops of our second reagent. Then we're going to take the swab that we obtained from our patient, and remember not to touch the end of this, and we're going to insert that inside of our test tube, and we're going to twirl that thing 10 times. And then we're going to let that swab stand for 1 minute inside of the fluid. Okay, a minute has passed, and our next step is we're going to remove the swab from the test tube, and we're going to press it against the sides so we get all of the fluid as much as we can out of the swab. And we can place that back inside of the paper there. Okay, our next step is we're going to take out one of these dipsticks, and this is going to be the actual part of the test that we'll be able to read to see the results. And it's very simple to do. We're going to insert the white end, and we're going to insert that in our test tube. And we're going to let that set for 5 minutes, and make sure that you mark your time. And in 5 minutes, we'll have the results of our test.
If that bacteria is present on the cotton swab, when we add the reactant, it's going to show positive.
5 minutes have passed, we're ready to interpret our results, and what we can do is we're going to compare our test strip to our card, and as you can see, we have one small red line which indicates that this test was negative. If it were a positive, we would have 2 red lines on the test strip as is indicated on the procedure card. And as we expected, our patient does not have strep, and this is a negative result.
It's all in the training, it's all in the placement of the tongue depressor or the actual strep test swabs that you're using. And it just takes great care in knowing how to do it.